have our institutional repository, and of course we have a policy in place. So one of the things that we are intending to do is, the first thing is that we want to increase the number of items in our pilot DHL. You remember when you visited the University of Nairobi, you were shown our pilot DHL. So what we are intending to do is that we want as much as possible to increase the number of items that are there. Currently we have around 90 items so far. So we want also to create other communities so that we cover every part of our repository. And the people who will be in charge of this definitely be the digital repository staff. I'm sure you remember, you saw that team. They are the ones who will be working closely with our technical working committee team, so that we are able to get enough materials. Of course, we are going to use scanners and camera for that matter. On the key tasks, we are actually going to do a lot of harvesting from the main repository. Under the main repository, we have a community for the College of Health Sciences content. So we are going to harvest whatever is there, and of course, and the others that we'll add. No, there is a lot that is going on at the College of Health Sciences in terms of research. We have a number of projects that are being run there. So definitely we are going to get the content from these projects and then upload them into our repository. And of course, another thing is that we are going to explore ways of getting articles from the Ministry of Health. I know this is not going to be very easy, because we've tried this before and we've had challenges. You know, the way our country is, anything requires that you need to come up with a memorandum of understanding. So we are going to involve our seniors and see how best we'll get the information from the ministry. A lot of projects in the field of health are actually going on. The reports, articles are actually written on daily basis. So if we get access to information from the Ministry of Health, I'm sure we're really going to benefit a lot. So that's why, like yesterday, I was saying that having Camry on board could have been an advantage to us. But we'll explore ways of getting information from this ministry. Of course, the issue of scanning and uploading of health content, that one will just be continuous. It's an exercise that is an ongoing. So the College of Health Sciences, we have 2 scanners, the ones that we bought using the grant that we received. So the people there will be doing the scanning, and of course, once we scan, we normally send the content to the main library. Remember, you also the digital unit area. So we normally send the information there, and they upload it to our repository. And of course, we are going to have an additional communities and collections in our pilot digital repository. And of course, the lead people will be the digital repository librarians and the technical working team. There is a team that is in place to oversee the day-to-day activities of our project. So those are the people who will be in charge of this exercise. Number 2, we are intending to increase awareness on use of a digital health library repository at the College of Health Sciences. Remember, we are actually targeting the College of Health Sciences community of users. So those are the people we are really trying to create a lot of awareness. So far, we have very good support from the current principal, College of Health Sciences. Wherever they have meetings, where there are college meetings, they normally try to sensitize people that we have this kind of platform where the faculty, the postgraduate students, and even the other users can access health content. So definitely we are going to have a number of trainings that we'll go through, so that we are able to sensitize our people that we have this kind of information. And at the College of Health Sciences, We recently launched a club called the Knowledge Ambassadors Club. This is a club that's made up of medical students who are more than willing to help us in sensitizing their own students on how to access the digital content. Well, of course, that club has, they have officials, so wherever we have trainings, wherever we have workshops, we normally invite them to come on board and get some information from us, which they later on take to their fellow students. So the Knowledge Ambassadors Club has been very much helpful in our college, and I'm sure that is the group that we'll continue to using so that they're able to deliver the gospel to their peer students. And of course, that one, the issue of training will be done on a monthly basis. Of course, we already have a program that stipulates on what needs to be done. And of course, our technical working team will be doing that. They will be engaging the management and on issues to do with training. Because, you know, you just come up with something very good, and very few people are aware of it. The issue of utilizing that product may not really be that good. So you need to sensitize your users that we have this kind of platform so that they're able to make use of it. And on the issue of monitoring and evaluation, of course, we have, as I said, we have a technical working committee that will be doing that, and we normally do quarterly reports and on the progress of our project. So assessment on usage and the content size will also be covered. Of course, that one will be done by the PI and the committee. And then around May, we are usually, God willing, we are likely to launch our digital health repository to the outside world. So, remember, you saw what we had was just a pilot. So we are praying that by May, we should be able to have everything in place.